All right. My name is Lisa Merheb. I'm a social worker at Sylvester Comprehensive Cancer Center. I'm also the interim director of social work department at this time. So I'm going to discuss with you the psychosocial implications of GIST through the continuum of care. So there's lots of social workers out there in the community and hospitals, but what we have at Sylvester is oncology social workers. So what is the definition of oncology social worker? The oncology social worker is a primary professional discipline that provides psychosocial services to patients, families, and significant others facing the impact of a potential or actual diagnosis of cancer. And we do clinical practice, education, advocacy, and other important things, policy research. So this morning, we were discussing what was GIST, uncommon type of cancer. These are things that we've already discussed earlier in the day. Belongs to a class of disease called sarcomas. Okay, we know about that. We know it develops in the GI tract. And we're going to go into what a social worker does in regards to providing support when there's an initial diagnosis of GIST. And whenever someone has this initial diagnosis of something very serious, you know, people always try to say, oh, try to keep positive, don't worry, just focus on the, you know, and it's not, and it doesn't really go that way. So, you know, like this little comic says, you can't let this get you down, just push the negative thoughts away. And it doesn't really work that way. What we do have at Sylvester is something called a distress screening form. And this is currently under revision, so this is going to be changing pretty soon. But what it does is it measures the amount of distress someone has. So, you know, the top part is more general distress in the past week, 1 through 10. And then we go into practical problems. So this is what social workers at Sylvester get involved with when there's a lot of distress in a particular area. And it could be anywhere from practical problems such as housing, insurance, work, school, transportation, excuse me, childcare, family issues, emotional problems, spiritual issues, or physical problems as well. But of course, physical problems you always discuss with your, you know, your primary oncologist and the medical team. So this is kind of a way of measuring distress and distress that patients are experiencing, but also family members go through these kinds of distress as well. Initially, when we see patients, we do an assessment as far as coping, if we're called to the clinic or even outside the clinic. We discuss ways of, you know, sometimes short-term ways of just expressing feelings. We work on strategies. So strategies in regards to financial support, emotional support, practical problems, transportation issues. Someone could be presenting with depression, and when we assess the situation a little bit more, we realize that they're going through a lot of financial distress. They don't have a way to getting to Sylvester. There's all these other psychosocial issues that we can work on, and then the depression subsides because they feel like they have a way of getting to Sylvester. They find some financial support. We apply for Social Security benefits, things like that. So we evaluate the whole person and what's going on, and, you know, with the person in general. We also refer to other team members. So depending on our evaluation, we refer to team members. We refer to music therapists, the chaplain, our palliative care. We do have a palliative care program at Sylvester. Dr. Zaw is the main doctor. We also have other palliative care doctors here at Sylvester, and they work on symptom management. There's this whole misconception that palliative care is hospice care, and they overlap in some degree, but they don't really. So you can go to a palliative care doctor, and it has nothing to do with hospice care. So basically, it's symptom management. They look at your symptoms, they evaluate your symptoms, they look at pain, they look at your pain levels, they adjust medications. So they look at you as a whole to provide symptom management. And people that go to palliative care doctors do well as far as symptom management, and things like that, because that's their whole focus, on your symptoms and make adjustments in regards to your symptoms. So you can always make an appointment to see the palliative care physician at Sylvester. We talked a little bit about psychiatry. Our psychiatrists focus on cancer related issues. So it's not your traditional psychiatrist that in the community where they're not cancer focused. Our psychiatrists do treat, as we discussed earlier, other symptoms other than depression, and it could be depression, anxiety, but it could be something more than that. It could be, like you're feeling fatigued, and your labs are okay, and your doctors are saying you're okay, but you're still exhausted and things like that. So they can do an evaluation. They can prescribe, if they feel it's clinically indicated, they can prescribe medications for that. And then also they have a way of getting their authorizations, because they know the jargon that the insurance companies need to know to get it authorized. We also have acupuncturists, and even in the satellites, the goal right now, what we're aiming towards is that, you have Sylvester, and then you have Deerfield and Plantation and Coral Springs and Kendall, and soon to be, we're going to have Coral Gables. But what we're trying to do is get all these services provided at all the satellites. So even if you don't live in Miami, if you live further away, you can get acupuncture treatments, massage therapy, psychiatry, psychology, things like that to help support, your journey through this illness. And then we also have an exercise physiologist, and a lot of these services are provided at the satellites. I can give you the phone number to call to make an appointment. And I can do that in a bit. So, okay, so I'm going to move on to the next slide. Any questions regarding that? I know I said a mouthful, so okay. So it's important to choose the right doctor, as was discussed earlier. You need to find a doctor that specializes in I always say, if someone, even if my friends or family members, there's something going on, always get something serious, always get a second opinion. It doesn't hurt to get a second opinion. Get the pathology slides looked at once again. So sarcomas are best diagnosed and treated by sarcoma experts in a sarcoma center. As you know, Sylvester is a sarcoma center. Always call your insurance for a list of doctors, deductibles. Always ask your insurance companies as well, as far as like MRIs, CAT scans, things like that. How are they done? I know some plans you need to go through your primary care physician to get a referral in order to get that done. So always know your plans. That's very important. Every plan is different. Not one Blue Cross plan is the same as another Blue Cross plan. They all have different things. They all have different nuances and co-payments, deductibles, things like that. So really get to know your plans. And see if your PCP has any recommendations. Connect with other patients that have doctors in regards to their experience with them. So implications in regards to treatment. We know there's 4 types of standard treatment. It was discussed this morning as far as surgery, targeted therapy, watchful waiting, and we discussed a little bit more about the supportive care, palliative care. Very important if you're having, lots of symptoms and things like that, to talk to your doctor, to see the palliative care physician. In regards to surgery, whenever someone's going to have surgery, depending on the plan, they always require a certain amount of money. And if you can't afford it, try to negotiate as much as you can and work with the hospital in regards to the surgery. I don't know if you're familiar with the FMLA, Family Medical Leave Act. The Family Medical Leave Act is a federal law only protecting that you have a job going back to your employer. So it doesn't guarantee that you're going to have the same exact job. It doesn't guarantee much other than you will be employed by your employer when you come back from leave. And I think it's only about 12 weeks long. And you can do continuous or you can do intermittent, which means 3 days here, so it's just a law that protects that you have a job. They're not even required to pay you when you're out on leave. Advanced directives, ACA, which is the Agency for Healthcare Administration, they have, I don't know who here has an advanced directive. I've had mine for 10 years. It's always good to have. I always say, even if you don't have cancer, you should have an advanced directive. An advanced directive is basically, discussing your wishes in regards to, and it doesn't even have to be cancer related. Any one of us can have an accident, God forbid, whatever. An advanced directive is used at that time. Basically, it expresses your wishes. The form on the ACA website is excellent. It's very thorough, and it's always a good practice to have. Home care needs. Always discuss with the surgeon as far as home health care. Make sure your insurance provides home health care. Sometimes home health care is limited to 20 home health visits a year. There's a lot of policies out there that have a limit to how much nursing can go into the house. Always discuss home health care, when you're considering surgery. So interventions during treatment, we reassess, see how things are going. People call as far as questions, where do I go for this, where do I go for that? Always call me. I will be more than happy to help with anything. We look at community resources, continuous financial assistance, and building on previous learned from the previous learned skills and what we talked about. So we're going to go to targeted therapy for GIST. Okay, so we know we're very familiar with these medications. They were discussed earlier, and Gleevec is the most common, and there's Sutent and Stobarga. In regards to specialty medications, we know we have co-payments. The lucky ones don't. It's very rare that you don't have a co-payment, but typically you do. Hopefully you can afford your co-payment for these specialty medications, but if not, I can assist with co-payment assistance programs. We know the patient assistance now, oncology, which is Gleevec. There's a website that's pretty good that we use a lot. It's Needy Meds. This is the website. And it could be for any medication that you're on. It doesn't have to be a specialty medication. It could be for pretty much any medication. You type in the name of the medication and any copay assistance comes up. And for example, Neulasta, I don't think you guys don't use Neulasta, but it could be a simple thing where you look at the patient assistance program for a medication and you go to Needy Meds, you punch in whatever medication, and it shows you all the copay assistance programs there are. Most of them, actually. I discovered some more other than Needy Meds has for Gleevec. So anyway, but Needy Meds is a very good website. Share it with your friends and your family. It could be a 5-minute phone call. Like just yesterday, I had someone with $3,000 copay. I had them call Amgen Patient Assistance Program for another, it's a post-chemo drug. 5 minutes, they saved $3,000. Copay was $0. So always good to have that website. You can always talk to your specialty pharmacy as far as patient assistance programs. Sometimes they have a special dedicated team to help with copay assistance. Go back to your specialty pharmacy, say, hey, do you have any copay assistance that you can assist me with? This is a very large copay, and see what they have to say. And there's something called tier exceptions that's really with the insurance companies, and sometimes they have all these classifications, and you can look into getting a tier exception. It's very rare. I haven't had much success with a tier exception. So this is a website we just found out recently, since there has been some changes as far as the copay assistance programs for GIST patients. So I did a screenshot of this, and it's called PSI, Patient Services Inc. And there's a lot of other like there's bleeding disorders, and then there's cancer, and I guess you can barely see this, but let me see if I can find. So on the website, oh here, gastrointestinal stromal tumors, Copayment. This program is accepting new patients. So if you see that on the PSI website, go ahead, apply if you have a copayment. So we're having success now with this, since there's been a shift in especially with Gleevec, with the patient assistance programs. But PSI has been so far successful as long as they have funds. So that's the key word. If you see on the website they have funds, they have funds. So call them, apply, get copayment assistance, and hopefully all will go well. We know about specialty medications. They typically have to be assigned to specialty pharmacy. A lot of plans are going through CVS specialty, CVS Caremark. And if you're having problems with that pharmacy, call me. I have a special dedicated email address that I can contact through, and because sometimes CVS Caremark can be a little bit of a bumpy road, but so far we've been doing well with them. We need authorization, so that we talked about co-payments, and all specialty pharmacies ship directly to the home. I don't get involved with medications or getting them shipped to the hospital. They usually collect payment before shipment. And we're going to, anything about medications, specialty medications, I know that was a big one. Any questions? Okay. Caregiver support. A lot of us, social workers focus also on caregiver support. It's difficult to be getting treatment for cancer, but it's also difficult for the family members as well on many levels. We do refer to community support groups. We have our own cancer support groups. It is on the Sylvester website in regards to support groups. We're looking at developing more online support groups, so that's going to be very exciting. Our team, our psychiatrists and psychologists, also can work with the family members here at Sylvester. So it's not just about the person getting treatment, it's about the family as well, and children. So we do provide support for the family. There's also online support groups, communities. It's important to connect with other families. Some people, even in the waiting room, waiting to see their doctor, have made connections, and that's always very good, and even venues like this. So these are a list of resources for GIST that I've compiled. I don't know if you want to write them down and anything that comes up. So we have the Life Raft Group, Sarcoma Alliance, American Cancer Society sometimes can also zone in your area in particular as far as providing support. So you can call the American Cancer Society, they'll ask you for your zip code, and you say, I need help with transportation, I need help with getting a second opinion, I need help with this, I need whatever. So have a discussion with them. They can even zone in your local support group, local support, as far as whatever help you need, as far as transportation, second opinions, things like that. And they'll probably refer you to the Life Raft Group or Sarcoma Alliance and Sarcoma Foundation of America. So these are very good organizations that can help. So when we discuss after treatment, or when you're stabilized, ready to go back to work and can continue your life, just after treatment, one of the things that comes up is living with uncertainty, anxiety of recurrence. End of treatment can be stressful and also exciting at the same time. Sometimes people are so used to kind of going to their doctors a lot and things like that, and so they sometimes when they're kind of going for checkups a lot, spaced more out than usual, and sometimes family dynamics we notice change. when someone is in a crisis, the family dynamics change, and sometimes when you're better and you're ready to move on, it's like the family has a hard time letting go or adjusting back to the kind of like that you're able to do things on your own, and and you're okay. And so there's a little bit of adjustment as far as the role of the family and how it all works out at when you're doing well and you're kind of after the crisis. And sometimes people in crisis situations and difficult situations kind of have to get through it, and they put their emotions aside, so they're not really they're just like trying to get through the crisis. And sometimes when things calm down, you start thinking, oh my God, things start coming back to mind, and it's important to kind of get some psychological help and support in that way to help process what happened, what it meant, and where you're at, and things like that. Re-entry into the workforce is always a very big one, as far as going back to work, and it's, there's a lot of things, and there's Cancer and Careers has they have good workshops as far as getting back to the workforce and what to do, and they give good tips. And of course, it's dealing with the what ifs. What if it comes back? What are the chances if it will come back? And this is a very common thing that people go through. Also, to ensure access, making sure that you have stable insurance, that your insurance is not going to, you're going to have access to medical care through your insurance and those kinds of things. And this comes from, I think, mostly the Cancer and Careers website, job hunting after treatment. These are some tips, what to do as far as job hunting, tailoring your resume to format to your needs. And they also have online educational workshops as well. So lots of things are discussed in that the Cancer and Careers. It's a really good website. Rehearse your job interview ahead of time. Know about employment laws that are relevant to your situation. Check in with your boss once you're hired regularly, if that's been discussed as far as your condition, And then just so you know, to put it in perspective, that more than 10 million in the people in the U.S. are cancer survivors, and many are in the prime of their working years when the cancer is diagnosed. So, you're not the only ones in that sense, that this is a common thing. Cancer is affects many people. So, these are tips to cope with uncertainty in regards to so in order to kind of get through, there's a lot of uncertainty as far as when you're after treatment and when you're in that stage. It's important to be informed. Learn what you can do for your health right now. Check with your doctor for a list of common signs of recurrence for your type of cancer. And this is a hard one, except that you don't have control over some aspects of your cancer. And it's hard for us to kind of say, okay, I can do this, but at a certain level, I have to accept that there's only so much things we can do and so much things we can't in that sense, but that's a tough one. Be aware of your fears, practice letting them go. Sometimes doing some relaxation exercises. And relaxation is something I always say you have to practice. It doesn't come naturally, so you have to practice it. Even if it's 5 minutes a day, try to practice some relaxation. You can even do 5 minutes in the morning, 5 minutes in the evening. YouTube, there's so many apps out there that have relaxation exercises. For even caregivers as well. It's important for caregivers to take care of themselves and, try to relax and practice, letting go of anxiety, of stress. Express fears of uncertainty. It's okay to express your fears of uncertainty. with a trusted friend or counselor and even some family members. But it's, if you're struggling with anything at any point in time with your situation, reach out for help. I think it's very important. And then, at a certain level, it's not good to keep things in and kind of let it build and build and build and build. It's okay to go to somebody, and you may try one person, and that person you don't connect with, and then you have to shift to another person. So it's okay. It's not all counselors are made alike. They all have different skills and different strengths. If you don't connect with that one person, feel free to switch to another person, and then hopefully you'll find someone you can really connect to, be open with, and really express your thoughts and your feelings. Practice being in the present moment, mindfulness, that's really, really good. We talked about that. Work towards a positive attitude. Use energy to focus on wellness. Our exercise physiologist is really good as far as exercise and getting you back into an exercise plan to build strength and things like that. Her name is Stacy. She's very good. Find ways to help yourself relax. Be physically active as you can, and control what you can. And these are my references for this slide presentation, and this is my direct number. You can feel free to call me if you need more to have further discussion as far as anything I presented today. Also, if you want to make an appointment with any of our additional services such as psychiatry, psychology, acupuncture, it's a one phone number for all the sites. It's 305-243-4129 is the last 4 digits. Any questions? Thank you.